This video will cover the renal function test, which is crucial for evaluating kidney health. Presented by Medicos Online. The kidneys are bean-shaped organs, each containing about 1 million nephrons. A nephron consists of an outer layer, the cortex, and an inner layer, the medulla. Key components include glomeruli, the PCT, DCT, CD, and the loop of Henle. The kidney's functions include urine formation, excreting metabolic end products, regulating salt and water balance, maintaining acid-base balance, and producing hormone. We test renal function to assess kidney capacity, detect renal impairment early, determine the severity of impairment, monitor treatment response, and ensure the safe use of excreted drug. Renal function should be assessed in cases of older age, family history of chronic kidney disease, decreased renal mass, low birth weight, diabetes, hypertension, and various infections or obstructions. Macroscopic examination begins with color. Normal urine is pale yellow due to urochrome and urobilin. Variations in color, from red to black or green, can indicate different underlying conditions or the presence of various substances. Normal urine volume is 800 milliliters to 2.5 liters per day. Oliguria is an output below 300 milliliters, seen in acute glomerulonephritis and renal failure. Polyuria is over 2.5 liters, seen with increased water intake or diabetes insipidus. Anuria is less than 100 milliliters, seen in renal shutdown. Normal specific gravity ranges from 1.002 to 1.025 and varies with urine quantity. Low specific gravity can indicate chronic renal failure or diabetes insipidus. High specific gravity can be seen in dehydration, diabetes mellitus, or albuminuria. Urine pH normally ranges from 4.5 to 8, being slightly acidic between 6 and 6.5. It becomes alkaline after meals. Exposure to the atmosphere causes urea to split, releasing ammonia ions and resulting in an alkaline reaction. Renal function tests are classified into 4 categories: urine analysis, tests for glomerular function assessment, tests to measure renal plasma flow, and tests for tubular function assessment. Urine analysis is a valuable and easily performed test for renal function evaluation. It includes physical, macroscopic, chemical, and microscopic examination of the urine sediment. Tests for glomerular filtration assessment include clearance tests such as creatinine, urea, and inulin clearance, as well as the dilution and concentration test and serum electrolyte level measurement. The clearance test expresses the volume of blood or plasma completely cleared of a substance by the kidney per minute. Maximum urea clearance occurs when urine output is 2 milliliters per minute. A urea clearance greater than 70% indicates normal renal function. Between 40 to 70% suggests mild impairment, while less than 20% indicates severe impairment. The creatinine clearance test procedure involves collecting a 24-hour urine specimen, measuring creatinine concentration in both serum and urine, and carefully measuring total urine volume before calculating creatinine clearance. The calculation of the creatinine clearance test uses the formula CCR equals U*V divided P. The corrected formula adjusts for the body surface area, A, as shown here. Kidney disease is staged based on glomerular filtration rate values. Stage 1 is normal, with GFR at or above 90. Stage 5, end-stage renal failure, is a GFR below 15. The inulin clearance test uses inulin, which is neither reabsorbed nor secreted by renal tubules. Its clearance value equals the GFR, and it is administered intravenously to measure GFR, though it is not used in practice. Tests to measure renal plasma flow include using para-aminohippurate, or PAH. PAH is filtered and secreted, and its clearance at low blood levels measures renal plasma flow, which is typically 574 milliliters per minute. Filtration fraction, or FF, is the plasma fraction filtered by the glomerulus. It is calculated by dividing inulin clearance by PAH clearance. The normal range is 0.16 to 0.21 in adults. Tests to measure tubular functions include the urine concentration test. This determines the renal tubule's concentration ability, assessed by measuring urine osmolality after water restriction. A lower osmolality may indicate a chronic renal failure or acute tubular necrosis. The PSP excretion test measures tubular activity and renal blood flow. Excretion of less than 23% of the dye in the specified period indicates impaired renal function. It can also assess individual kidney function. The urine dilution test assesses the kidney's ability to eliminate water by measuring urinary output after large water ingestion. This test is not advised for patients with adrenal insufficiency. The urine acidification test checks the tubule's ability to produce acidic urine, typically between pH 4.6 and 5.0. In renal tubular acidosis, the pH remains above 5.3 even after ammonium chloride administration. This image provides an overview of various kidney function tests, including serum markers, clearance tests, and tubular function tests.